living well with difficult emotions and situations. The practice of mindfulness teaches us that we are deeply aware that not every moment in our lives is filled with joy, and that part of being human is the experience of pain and suffering as well. Understanding the difficult moments and feelings will come and they will go. The practice of mindfulness helps us to drop our resistance to wanting things to be different than they are, and allows us to embrace difficulties with courage and safety. When we make space for difficult emotions or situations, we create the capacity to shift our perception in which the difficult moments become less scary, less powerful, and less overwhelming, knowing that this moment too shall pass. Over time and with practice, it makes the difficult times easier to manage as we learn to change our relationship to arising stress, difficult emotions, and situations. Research has strongly shown that healthy eating, exercising, good sleep hygiene, and mindfulness and self-compassion practices all contribute to living well. The immune system further is impacted by these practices as it positively correlates with healthy immunologic aging, ultimately benefiting against threats of infection and autoimmune disease as we age. Healthy behaviors, as just discussed, impact the immune response and strengthen our empathy responses as caregivers. Ironically, as we participate as caregivers in providing compassionate-based care, we incur pain and suffering at many levels as we are exposed to our own pain and suffering, in addition to bearing witness to the pain and suffering of the loved ones we care for. The importance of compassion pointed inwards is pivotal to our well-being. Turning towards something painful and responding with kindness and self-compassion can help us to cultivate our own resilience and health as we caregive. Treating ourselves with kindness, just as we would treat a good friend, and recognizing that we, as human beings, all suffer, can help to ease our understanding that we are all deserving of care. As humans, we can find ourselves sharing this common humanity, this trait of imperfections, with other human beings, and this can be an eye-opening experience as it gives us permission, not excuses, for our limitations and mistakes as humans. As humans and as caregivers, we tend to harshly critique ourselves and our behaviors, and tend to be guided by our own inner critical voice versus a kind, self-compassionate voice. The challenge is finding the time, energy, and resources to care for ourselves as caregivers. Our fear of failure can also be the driving force behind our behaviors as caregivers, and as a result, this can be a costly endeavor as it can serve to unmotivate us in the long run. Research shows that people who have the capacity to provide themselves with kindness and self-compassion actually have greater capacity to motivate themselves without relying on the fear of failure in the short term to motivate them. Self-compassion is in the moment, versus self-care is often an off-the-job requirement, like going for a walk, taking a warm bath. Therein lies why, as caregivers, we run the risk of compassion fatigue and burnout if we repeatedly experience pain and suffering without taking good care of ourselves in the moment as we caregive. Taking the time to practice mindfulness and self-compassion have been shown to be beneficial to the caregiver. Once the practice has been learned and practiced, it can be applied on the go and in the moment for the caregiver when pain and suffering arises, therefore helping to alleviate the experience of pain and suffering.